Hello, my name is Lovely and today I'm going to demonstrate a full bathing. So full bathing includes hair care, oral care, and full body wash. So let's start. First, we need to check the doctor's order and then proceed to the patient's room, knock 3 times. Hello sir, how are you? My name is Lovely and I'm going to be your caregiver for today, okay? May I have your wrist please? Can you please tell me your name and your birthday? Alright, thank you so much for that information, Mr. Smith. So, Mr. Smith, I am here to provide a full bathing for you. So, full bathing includes your hair care, your oral care, and I'm gonna wash your full body. Okay? This is necessary to maintain a personal hygiene, remove bacteria that causes odors, and of course, to make you feel fresh. Okay? So, before we start, let me just go and wash my hands. And then I'm gonna go back to you and I will just prepare also the equipments, okay? Alright, so prior to this demonstration, I've already did the proper hand washing. And now I'm going to wear my gloves. So for the purpose of this demonstration, I'm gonna wear 2 gloves. And then let me gather all the equipments needed. So first, we will be needing 2 basin. One for soapy water. The other one for clean water, plain water. And then urinal for men. Bedpan for women. Kidney basin. Cotton buds, cotton balls. Baby oil, if necessary. We also need the toothpaste, toothbrush, tongue depressor, and then glass of water, shampoo, conditioner, shaving cream, shaver. Of course, we will need soap, 3 sponge cloth, vital signs, sets of vital signs. We will also be needing a rubber sheet, 2 clean bath towel, and then bath blanket. We will also be needing a clean gown, and then 2 buckets. Kelly spot. So this bucket is for the clean water and then the other bucket is for the waste. Laundry basket and then the waterproof pillow and the waste bin. And then a clean top sheet. So now let's go back to the patient. Okay, so before we proceed bathing the patient, we have to do the vital sign first, okay? And make sure that the vital sign is normal, including the body temperature, the blood pressure, the respiration, and the pulse rate. Okay? Hello, sir. So let me just, before we start, let me just adjust your bed in a comfortable position. So I'm gonna make this bed in a sitting position. Around 60 to 90 degrees. Then let me just put down the side rail. I'm gonna provide the privacy, close the door, close the window, and put the screen. So, Mr. Smith, let me start now. So, first, let me just place a towel into your chest, okay? And then, with a glass of water, I'm gonna start cleaning your teeth, okay? So, can you please sip, gargle, and spit? Thank you. So, with the toothpaste and the toothbrush, alright, so let's start with your upper teeth. I'm gonna brush the upper outer teeth from left to right. Inner upper teeth, outer teeth, left to right, and inner outer lower teeth, left to right. Can you please sip, gargle, and spit? Thank you. And then pat dry. So now let me get the tongue depressor. Can you please show me your tongue? And scrape the tongue. Sip, gargle, and spit. Thank you. And then, pat dry. Mr. Smith, do you want me to shave your facial hair? Okay. So, if the client says yes, then let's start shaving the hair. But first, we need a damp cloth. And then wipe the facial hair And then let's get the shaving cream. And then gently apply the shaving cream on the face of the patient, starting from here. Going down. Mr. Smith, can you please move your face towards me? Thank you. Can you please tuck in your upper lip and your lower lip? Okay, so now let's get the shaver and another clean cloth. So starting from the face, going down in one motion, shaves. Can you please tuck in your upper lip and your lower lip? Can you slightly chin up, please? Thank you so much. And then get the damp cloth, soak it in plain water, and then wipe the excess cream. Thank you. Let me pat it dry. So let's move cleaning your hair, okay? Okay, so now let me just adjust your bed and return it to its original position. Of course, it needs to be in a comfortable level. Alright. Mr. Smith, I will just move you slightly towards me, okay? So, in a count of 3, please operate. 1, 2, 3. And then I am going to change your pillow as well. So I'm gonna replace it with a waterproof pillow. So let me just remove your pillow in a count of 3. 1, 2, 3. And then this one. Thank you. So Mr. Smith, I'm going to adjust the waterproof pillow behind your back, okay? So let me just, in a count of 3. 1, 2, 3. Thank you so much. Okay, so now let me just place the rubber sheet. This spot. Okay, so before we start washing the hair of the patient, we need to check if there's any wounds, cuts, or lice. So if there is some, then we have to report it and do not continue washing the hair. But if the head is clean, then we can continue. So let's proceed. Place 2 pieces of cotton balls in both ears. And then get the bath towel and cover it. Over the neck going to the shoulder. And then a piece of face towel to cover the eyes, to protect the eyes. Alright, so let's first wash the hair. And then get an ample amount of shampoo. And then scrub gently onto the head to circulate the blood flow. And then rinse. Okay. So once done, we can also apply a conditioner. You have to ask the patient first. Sir, do you want me to put a conditioner?
Yes.
Okay. So let's add a conditioner, ample amount. And then rinse. Remove the Kelly's pad. Then pat dry the hair. Remove the face towel, and then the cotton buds, and then remove the rubber sheets. Let me just adjust the pillow, okay? On the count of 3, 1, 2, 3. Thank you. Okay, so now let me put the rubber sheet back. Mr. Smith, in a count of 3, I'm gonna place the rubber sheet again under your head. 1, 2, 3. And then let me remove this. Get another bath towel. Let me just place this bath towel under your head. 1, 2, 3. Thank you. So, Mr. Smith, I'm going to clean your face now, okay? I'm gonna cover your chest with another towel. Okay. So now let me start. Get a washcloth, and then first clean the eyes. Soak it in clean water. Squeeze the excess water. And then starting from inner canthus going out, outer canthus going out, inner canthus going out, outer canthus going out. And then, pat dry. Mr. Smith, do you want me to put a soap in your face? Okay, so if the clients agree, then we have to use a soap. Soak it in soapy water, squeeze the excess water, and then starting from the forehead, in circular motion going down to the cheeks, to the bridge of the nose, chin, neck, and then back of the ears. On the other side, and then same procedure for rinsing, pat dry. Alright, so now let's clean your nose. Going to get a cotton buds rather. And then soak it in clean water. Mr. Smith, I will just put the cotton buds inside your nose. Going out. And dispose. Then pat dry. Now let's clean your ears. I'm gonna get another cotton buds. And then starting from inner lobe going out. Get another cotton balls. Inner lobe going out. And once it's done, pat dry. Let's remove the bath towel. In a count of 3. 1, 2, 3. Thank you. And then, let me remove the Macintosh. 1, 2, 3. Thank you. Let me just raise the side rail. Let me just position your hands under the breast, and then this side of the hands, arms up, cross leg. So, in a count of 3, please cooperate. 1, 2, 3. Okay, so let me untie your gown. Then I'm gonna tuck in under your body so it's easy to remove later. Okay, so let me put you back in supine position in a count of 3. Please cooperate. 1, 2, 3. Let me adjust you. 1, 2, 3. Bath blanket. Mr. Smith, will you be able to hold the bath blanket? If not, that's totally fine. Let me tuck in under your shoulder. Then put the soiled linen into the hamper. Next, remove the gown. And put the soiled gown into the hamper. Put down the side rail. Okay, so let me start washing the farthest side of your arm. I'm going to place the rubber sheet under your arm, expose the farthest side. Then fold it lengthwise. Okay. And then get a towel and place it under the arms of the patient. Mr. Smith. Thank you. Okay. So get the sponge cloth and soak it in soapy water. Remove the excess water. And then starting from the wrist, wipe going to the elbow and to the shoulder. Wrist, back of the elbow, to the axilla. Same procedure for rinsing and then pat dry. Get another clean basin and then soak the palm of the patient. Get ample amount of soap. And then gently massage the palm, the back of the palm, and pay attention to the spaces in between of the fingers. Rinse. Get the brush the nail, and then rinse. Remove the basin, and then pat dry. Do the same procedure on the other side of the arm. Okay, so now let's move to your abdomen and chest. We just remove the rubber sheets. Okay. So I'm going to cover your chest. And then let me pull down the back blanket up to the navel. Up until the navel. Washcloth and soak it in soapy water. Squeeze the excess water. Then starting from the neck, going down to the chest, round of the breast. Please pay attention to the fold skin up until the nipple. Soak in soapy water. Do on the other side, starting from the neck to the breast, round of the breast, to the nipple, and then do the same procedure for rinsing and then pat dry. Now let's clean the abdomen part. And then starting from the navel, in circular motion, please pay attention to skin fold. Do the same procedure for rinsing and then pat dry. Okay, so now let's move to your lower extremity. Let me remove this bath towel. And then I'm going to expose the farthest side of your leg. Okay. I'm going to place the rubber sheet under your legs. Can you please bend your knee? Get the towel, place it under the legs. So this is the time that we need to change the water, okay? So let's start from the ankle, going to the knees, down to the thigh. Ankle, side of the knees, and to the groin. Okay, same procedure for rinsing and then pat dry. Get another clean basin, soak the foot for 10 minutes. And then get ample amount of soap once 10 minutes is done. And then massage gently, rub gently to the foot, to the back of the foot. And then clean and pay attention to the spaces in between the nail toe. Rinse. Get the brush, and then brush the nail. Rinse, remove the basin, and then pat dry. And do the same procedure on the other side of the leg. Now, we are going to clean the back of the patient. Let's remove the towel. And then, the rubber sheets, or the Macintosh, and cover the patient. So let me just raise up the side rail. And then, position the hands or the arms. The other arms, raise the other arms. Across the leg. Alright, so Mr. Smith, in the count of 3, let me pull you now. 1, 2, 3. Okay. Macintosh. And then, the bath towel. So by this time, let me change or remove my first gloves. Put it on the bin. Get the sponge cloth and soak it in soapy water. Squeeze the excess water. And then starting from the back of the neck, in zigzag motion going down to the back. And to the buttocks. Back of the neck. Zigzag motion from the back to the buttocks. Same procedure for rinsing and then pat dry. You may also offer the patient for massage. Mr. Smith, do you want me to massage your back? No need. Okay, that's totally fine. So let me remove the towel now. And then the rubber sheets. Let me put you back in supine position in a count of 3. 1, 2, 3. Thank you. To me, just here. Okay. So, Mr. Smith, before we proceed cleaning your peri area, do you want to urinate first? Okay. So, let's put a bedpan. Okay. So, Mr. Smith, I'm going to bend your 2 knees. Okay. So, in the count of 3, please cooperate. 1, 2, 3. Let me fix it properly. 1, 2, 3. A towel. 1, 2, 3. So in the count of 3, I'm going to place the bedpan under your buttocks. 1, 2, 3. Mr. Smith? Please tell me once you're done, okay? You're done? Alright. Thank you. Let me cover you with another towel. And then let's start cleaning your peri area. By the way, if the patient is uncircumcised, you may need to retract the skin. So let's get the forceps, then the basin, cotton balls, soak in soapy water. Then starting from the tip of the penis in a circular motion, and then dispose the shaft of the penis. So this would be a 4-stroke. Let's start from here, going down. This pose. Get another cotton balls. Get another cotton balls. This pose, and then get another cotton balls. This pose until it's thoroughly clean, and then same procedure for rinsing. Get cotton balls and start cleaning the scrotum under the shaft of the penis to the side of the scrotum, going down to the anus. This pose. Get another cotton balls under the shaft of, and then going to the side of the scrotum, down to the anus. This pose. Same procedure for rinsing, and then pat dry. Now for the ladies or for the women's peri area, we will be needing a clean cloth. Using a peri bottle, wash the peri area. Then starting from mons pubis, going down to labia minora, labia majora, anus. Mons pubis, labia majora, labia minora, anus. And then mons pubis, clitoris, urethral opening, vaginal opening, down to the anus. Same procedure for rinsing and then pat dry with clean cloth. Remove the bedpan. Sir, let me remove the bedpan now. In a count of 3. 1, 2, 3. And this pose, the waist water. Now let's remove the bath towel. In a count of 3. I'm gonna remove the bath towel now. 1, 2, 3. And the rubber sheet. 1, 2, 3. Okay, so now, Mr. Smith, I'm going to dress you up. Okay. Starting from the farthest side. Let me remove the butt blanket. We'll put it on the hamper. Okay, so Mr. Smith, I'm going again to the side lying position. Going to position your arms. And then cross leg. 1, 2, 3. Okay, so let me put you back in supine position. 1, 2, 3. Okay, in a count of 3, please cooperate. 1, 2, 3. Let me adjust you. 1, 2, 3. How are you feeling now? That's good to know. Okay, I'm going to place a new top sheet for you. Then you might need to miter the edge. Set a foot drop as well for client's comfort. So how are you feeling now, Mr. Smith? That's good to hear. Okay, if you need anything, you just need to call me. You need to clean the equipment, remove your glove, wash your hands, do the aftercare, and documents what you have observed. Thank you.